Coronavirus is like nothing we have experienced in our lifetime. Lockdown and keeping people safe meant we quickly had to change the way we deliver health and care in Salford. Now we need your help to rebuild our health and care services so they meet your needs, the needs of your family and your community. Coronavirus stopped some services so people could stay at home and stay safe, but this delayed operations, treatments and referrals. We want people on those waiting lists to get an appointment safely as soon as possible, but we need to prioritise those who need to be seen first. Some may have to wait longer than usual, while some will have the option to be seen quicker elsewhere in Greater Manchester, where there are shorter waiting lists. We're trying out new ways to access health services that will not only make sure you are in the right place for the right treatment, but also avoid overcrowding in busy places like GP waiting rooms. For example, when you contact your GP practice, they will check to see if a GP appointment is needed or if you can get more appropriate care from other services like a physiotherapist or a pharmacy. To help with this, GPs have introduced online systems. This also means you no longer have to phone your practice to make an appointment or visit in person. You can contact them at a time that suits you. Coronavirus has changed the way we deliver health and care services, so as many people as possible can be seen without meeting face to face, like digital and telephone appointments and online support. These changes have helped in lots of ways. Better for those who have difficulties travelling. Clinicians have time to see more patients. It's safer for people to be at home. No travel or time sat in a waiting room, and some people actually prefer digital or telephone. So, although face-to-face appointments are still there for people who really need them, we want to keep some of these changes that have allowed us to do more health and care at home. Coronavirus is having a massive impact on mental health and well-being, thanks to self-isolation or anxiety around catching the virus, as well as more people needing bereavement support. We responded quickly by developing more easy-to-access support services. Feedback tells us this is working really well, so we want to continue offering digital consultations, a 24/7 helpline for mental health service users, the Beyond service offering support for people with anxiety or stress, and a Greater Manchester bereavement service. Coronavirus put our NHS through its biggest test in its 72-year history, and you responded, from sewing face masks to shopping for our shielded neighbours and walking their dogs. Communities came together, and the relationship between the NHS and the people of Salford has never been stronger. We want to harness this and recognise the impact community-led support can have on our most vulnerable people in Salford. To do this, we're significantly investing in the third sector, providing more volunteering opportunities, local social groups or activities to empower more people to live as independently as possible. Central to all these plans is tackling inequality. Coronavirus has shone a spotlight on the inequalities faced by different groups, like our Black, Asian and ethnic minorities, older people and people with disabilities. Throughout our plans, we will consider everybody's needs. This means we need to continue collecting and monitoring data such as public health information, mental health and people who use services to help us understand any issues and target resources at those most in need. To be involved in the big reset conversation, go to www.salfordccg.nhs.uk/big reset.